What's going on, guys? Spencer here with HM Massage. I uploaded this video a while back, and I uploaded it as a no talking relaxation video. But there were a few people who wanted me to explain the techniques I was doing and explain the different mindsets for these 4 massages. So I thought I would do that and showcase the intentions and the different goals in doing these 4 different massages and how I went about them. Of course, if at any point you do enjoy the video, feel free to give it a like. Otherwise, let's get into it. This first back massage is focused solely on the outside part of her body, or the lateral edges. So we're really focusing on the low back, all along the lats, the latissimus dorsi muscles. We'll get into some of the serratus muscles and the teres. What I'm doing here is using my knuckle to pull away from the spine. This is an area that gets very constricted and very pressed inward, and so it can help to really widen that and pull the fascia and the muscles away. I'm then using my palm to come up along the rotator cuff into the rear delt and triceps. And going upward towards her head is a great way to once again open up a very bound area. The lateral borders of your scapula and your shoulder joint are always tight, and the lats are actually a big cause of why we have forward shoulder posture. It's not always just tight pectoralis, but it can be tight lats as well. This area also contains many trigger points that reference all around the deltoid, down the arm, and even stretching into the lower and upper back. So this is a great area to work if someone has pain in any of those generalized areas. After that deep work, and it may not look like we have gone insanely deep, but the lateral edges of the back are very tender. But after that deep work, you always make nice, and so here I've just done some lighter effleurage, and I'm about to do the same techniques to the other side. Massage number 2, we immediately start having already warmed up the client a lot. You can tell from the red that's streaking down her back, we've already brought a lot of blood flow and loosened a lot of the connective tissues. So we're going straight in with our elbow. For my deep work here, you saw I went up to the head, and right there where I switched it back and I'm going against the grain or against the muscle fibers, that is how you get insanely deep, especially for that mid-scapular area. I really like using my forearm and elbow there because it's a nice broad deep stroke that doesn't hurt my fingers, and then I'll follow it up with some specific knuckle work if I need to, really working the top of the shoulder blade, her levator scapula, her trapezius, rhomboid muscles, supraspinatus, even some scalenes in there. All of these muscles are the ones that people complain about when they say they have pain in between their shoulder blades. Right there is a little boy infraspinatus work. That's the muscle that lies directly on top of their scapula, and that references pain and wraps around all the way to the front of the shoulder blade. So once again, a good area to work. And I moved down to finish off on some lower back pain because she also had that going on. So we're going down the erectors and stopping right at the top of the pelvis, the iliac crest. And then we're holding those erectors and the QL muscle, quadratus lumborum. This muscle, I believe, is the culprit for almost all back pain, and it attaches right to that lowest floating rib. So it's really good to press your knuckle upward towards that rib spine attachment. And once again, a great note is when we are going this deep, go slow. I'm not speeding through the body, I'm allowing it to welcome me and let me go through the tissues. Number 3, we're starting with some simple petrissage on the neck, the cervical spine. So once again, using a lifting, squeezing motion, really encompassing the whole neck. I'm not nipping at her neck, I'm putting the entire length of my fingers as far as they go, compressing, and then pulling up, and then alternating that technique between my two hands. This move will send tingles down anyone's spine. It feels very good, and this area, as most people know, is where we carry the weight of the world, all of our work stress, family stress, life stress. It all kind of gets pushed into here. And what I'm doing with my top hand is angling downward and hitting more of her upper back area. I switched the angle here, so now I'm getting a lot more of that sub-occiput, getting right up into the base of the skull, and then going down up to the top of the shoulders at that levator scapula. Really spending some good time at the base of the skull before I move into digging with my knuckles right at the top of the shoulder blades. And all this area loaded with trigger points that leads to headaches. If someone has a headache, you need to be doing these techniques and working the area, and also working both origin and insertion. You have to go to the attachments of the muscle, because it's important that you release the base, or what's really holding that tension in place, and not just work the middle where the pain is. You have to work the entire area. And as a good finishing move, my bottom hand slid down her back there, once again just connecting the whole massage. And last techniques of the video, this final massage, different from the other 3, is aimed more towards relaxation and flow. The first 3 were very deep tissue therapeutic based, but this one we're doing long gliding strokes, generally towards the heart, not really going too deep. We're using our palms, not knuckles, not forearms. And this, we're going lighter but firm. This is how I warm up every single massage, including the first 3 you saw. And it's getting a lot more of the skin and fascia involved, and then some of the top layers of muscles, but we're certainly not getting to the deep layers of muscles. I'm having a nice broad grip going all the way, using the sides, down the whole of the back, around the shoulder girdle, and continuing that flow. Now I have moved into a little bit of forearms, but this is still not deep tissue. You can see I'm connecting the flow by never having my forearms leave the body. And once I'm done using one forearm, which creates a nice broad pressure, I'm switching it right into the other forearm, so it feels like one long continuous stroke. Different angle just to showcase the same thing. And as we have warmed up a little bit, there's that cervical technique I just showed. Once we have warmed up a little bit, we can start thinking about going deeper, so I switch to knuckles. Once again, not doing anything crazy deep, but switching to knuckles and switching to forearms does allow us to start moving into that deeper tissue, which is ultimately what every single one of my massages ends up being. The client, they're going to start receiving a lot of increased blood flow, which is going to help out the nutrients. They're going to be insanely relaxed, and it is going to help get rid of pain and tension, maybe not just the deep trigger points that can refer a lot of pain and cause a lot of issues. A nice slow hold there, right at the traps and levator. I was shifting my weight back and forth between my feet for a sec, and that just added a slight vibration to the stroke. but look at how long I've just sat right there and let the muscles release under my pressure. I always say it, but I'm not pushing through the muscles, I'm simply allowing them to let me pass. And finally, once they do allow me to pass, from that deep work, we go back and make nice with lighter work and follow the stroke all the way down. You never want to have incomplete strokes where you stop halfway through the back or halfway up a muscle. You always want to do your best to follow through to the very end of where that muscle attaches. And as we finish up, a final note is that direction when it comes to light massage doesn't really matter. I did a lot of all over the place and even over the spine because I was going very light. But I did finish up with a few traction pulls and of course some effleurage. But thank you guys for watching. I do hope you enjoyed the video. Give it a like if you did and subscribe to the channel for new content every single week. I'll see you guys on the next video. Have a good rest of your day.